Hi, I'm Dave Esposito. I'm a vascular surgeon here at Milford Vascular Institute. And I wanted to talk a little bit about abdominal aortic aneurysm and what treatments we have available. As we've talked about in the past, an abdominal aortic aneurysm is when you get a bulging of the artery in the aorta just below the kidney arteries. So this is a model of the aorta. You have the aorta and the kidney arteries, and then you have this bulge, which is the aneurysm. And that bulge is dangerous because as it gets bigger and bigger, its risk of bursting gets higher and higher. And if the main blood vessel in your body bursts, that's usually a fatal event. So we diagnose an aneurysm with ultrasound, and then we typically have to decide whether or not we should treat the aneurysm to prevent rupture. What we know is that below 5 centimeters in size, aneurysms rarely rupture. So typically, if the aneurysm is 5 centimeters or less, we'll put you into a surveillance program where we watch the aneurysm, study it every 6 months, and watch it to see if it grows. As long as it stays below 5 centimeters, the treatment is medical. We'll control your blood pressure, control your other risk factors such as diabetes and smoking. We'll get you on an exercise program, things to decrease the chances that the aneurysm will increase in size. Once the aneurysm gets to 5 centimeters or greater, now the risk of rupture starts to go up. And so then we'll at least have a discussion about the various options for treatment. We may decide, if you're a high-risk patient, that watching the aneurysm is the safest thing to do. We may decide to intervene and treat the aneurysm so that it can never rupture. Typically, there are 2 options for intervening on an aneurysm. The first is the tried and true method that we've been doing for decades, and that's an open surgical repair of the aneurysm, where we basically open your abdominal cavity up and replace your aorta, take the aneurysm out and replace it with a new aorta. This is a graft that we would use. This would be basically a new aorta that we would sew into the aorta and replace the aneurysm. That works. That's a surgery that works great. It's a lifetime cure. However, it's a big surgery. It requires general anesthesia. It requires a lot of risk and a lot of recovery. Thankfully, about 10, 15 years ago, 20 years ago, stenting of the aneurysm came into being. And over the years, it's become very successful and has become really our go-to procedure for most people with aneurysms. What we do with a stent is we fix the aneurysm from the inside out. So this procedure is done under a local anesthetic or a spinal anesthetic. It's done through the groin, so small incisions in the groins, and we fix the aneurysm from the inside, where we'll actually put a stent inside of the aneurysm. So the blood goes through the stent and excludes the aneurysm, and we can fix it without having to open up the patient's abdomen. The recovery is remarkably quick. Typically, patients are an overnight stay in the hospital at most, and they're back in action in a few weeks. So it's really revolutionized the way we take care of patients with aneurysms, and it's allowed us to treat a lot of people who have aneurysms that we weren't able to treat before we had endovascular stenting. So really there's no one who should at least be considered for treatment of their aneurysm if it gets to be 5 centimeters or greater. So if you have an aneurysm, you should be in a program and have these discussions with your doctor about the various options for treatment. It's what we do here at Milford Vascular, and we're open for anyone who wants to come in and get screened or talk about their aneurysm at any time. So hope this helped. Have a great day.